everyone, I am Dr. Nandita Mohan and welcome to Medical Dialogues, your daily dose of health and medical news. Let's look into the reports of today. Weight loss operations are considered safe and effective in even children and adolescents for 10 years and above. Many obese youngsters, especially in their adolescence period, often put a thought of getting their fat removed surgically. Many factors like peer pressure, fitting into the society, be able to be medically fit are thoughts that crop up once in a while. Here is some good news for them. Results from a 10-year study of children and adolescents who underwent a common weight loss operation to treat their severe obesity showed that such patients safely have long-lasting major weight loss and improvement of their obesity-related medical problems without stunting their growth in height. The study, involving the longest known follow-up of pediatric patients after laparoscopic sleeve gastrectomy, is published online by the Journal of American College of Surgeons. During this operation, the surgeons usually divided and removed the part of the stomach, leaving the remaining stapled portions to create a sleeve in the form of a banana-sized stomach. This smaller tube-like new stomach enables the patients to eat less and thereby lose weight. It's also effective because surgeons remove the part of the stomach containing the hunger hormone that stimulates the appetite. Their long-term study results showed that patients lost nearly 30% of their total weight on average and had widespread reversal of type 2 diabetes and key heart disease risk factors with no procedure-related deaths or even major complications. Hence, losing weight surgically can be considered a safe and an effective option. Adenotonsillectomy for sleep apnea treatment in kids may improve bedwetting, reports a JAMA study. Children with obstructive sleep apnea are at increased risk for bedwetting, often termed as nocturnal enuresis. However, randomized clinical trials assessing nocturnal enuresis outcomes in children randomized to adenotonsillectomy versus watchful waiting are lacking. Hence, a report published in the JAMA Otolaryngology Head and Neck Surgery has found out that adenotonsillectomy for the treatment of pediatric obstructive sleep apnea appears to also result in improvement in bedwetting. A total of 450 children were enrolled in the study. It was found that at baseline, the number of children with nocturnal enuresis was similar between the adenotonsillectomy group and watchful waiting groups. The odds of nocturnal enuresis were approximately 2 times higher than the adenotonsillectomy group after a 7-month follow-up. Following adenotonsillectomy procedure, there was a slight decrease in the number of children with nocturnal enuresis. Therefore, the authors concluded that adenotonsillectomy for the treatment of pediatric obstructive sleep apnea appears to result in an improvement in nocturnal enuresis. Corticosteroid injections of hip may cause rapidly destructive hip disease. There is a common practice of introducing corticosteroid injections into the joints for relieving pain. The recent reports have suggested that hip corticosteroid injections can hasten the joint degeneration. One recent report published in the Journal of Bone and Joint Surgery that confirms that increased rates of rapidly destructive hip disease are especially apparent in patients receiving repeated high-dose corticosteroid hip injections. It was found that hip corticosteroid injections likely increase the rapid destructive hip disease approximately 8.5 folds. Greater the number of injections, greater was the risk. Higher the dose of the steroids, higher was the risk. However, the authors suggested that the risk of rapidly destructive hip disease following a single low-dose injection is relatively low, only for about 2%. The risk may increase to even 5% following multiple low-dose injections or a single high-dose injection, and up to 10% following multiple high-dose injections. Hence, it is believed that these findings can help to guide clinical practice for patients with painful hip osteoarthritis. Full vaccination with Pfizer vaccine provides protection for at least 6 months, says a Lancet study. Vaccine effectiveness is still the question in everyone's minds. Studies pertaining to the efficacy of various vaccines against SARS-CoV-2 infections are not confirmative. This has now been studied, but for only the Pfizer vaccine. The study published in The Lancet has confirmed that 2 doses of Pfizer are 90% effective against COVID-19 hospitalizations for all variants, even including the Delta, for at least 6 months. There is a suggestion that the effectiveness declined over the study period, falling from 88% within 1 month after receiving 2 vaccine doses to 47% after 6 months. However, the effectiveness against hospitalizations remained at 90% overall and for all variants. This is an important issue which is studied in Pfizer vaccines, but this needs to be studied in other vaccines too. Adding Ezetimibe with statin reduces the risk of cardiovascular events even in patients with low LDL cholesterol. Ezetimibe, when added to regular statin therapy, has been found to reduce the cardiovascular events not only in patients with very high LDL but even with those having low LDL. The 2018 US Cholesterol Management Guideline recommends additional lipid-lowering therapy with Ezetimibe for secondary prevention in very high-risk patients with low-density lipoprotein cholesterol. However, the therapy of adding Ezetimibe to statin in patients with cardiovascular events is still under-documented. A recent study published in the JACC journal has been found that adding Ezetimibe to statin consistently reduced the risk of cardiovascular events in post-acute coronary syndrome patients, irrespective of their baseline LDL values. The supported use of intensive lipid-lowering therapy with Ezetimibe even in patients with baseline LDL cholesterol. The trial was a double-blinded, placebo-controlled, randomized trial of Ezetimibe and versus simvastatin versus placebo versus simvastatin in post-acute coronary syndrome patients following for 6 years. It was observed that the effect of Ezetimibe simvastatin versus placebo simvastatin on primary endpoint was consistent regardless of the baseline value. Therefore, the authors concluded that Ezetimibe with statin therapy reduces the risk of cardiovascular events even in those having very low LDL values. That's all we have for you today. See you tomorrow.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.